Welcome back, everyone. In this brief section, we're going to talk a little bit about eicosanoids. When you hear eicosanoids, we're going to think about inflammation. Eicosanoids are local hormones that are released by all body cells. And the two main biggies are called leukotrienes and prostaglandins. Both of these are involved with inflammation. Now, many people have heard of prostaglandins before because if you've ever had a fever is a result of prostaglandins. If you've ever had a woman who's had menstrual cramps, the muscle contractions around the smooth muscle of the uterus is a result of prostaglandins as well. So if you sprained an ankle and your ankle is swollen, you may take a NSAID, you may take Aleve, a non-steroidal anti-inflammatory drug, which is an anti-inflammatory, and it's going to bring down inflammation around your ankle. But at the same point in time that you're taking a prostaglandin blocker, well, you could bring down your fever. Your fever can go down when you take that. You can decrease smooth muscle contraction and help the menstrual cramps when you use them. You can decrease the thickness of your blood and make your blood thin if you take an aspirin, right? Because it blocks platelet function. And you can also get an ulcer, right? How do you get an ulcer? Well, prostaglandins are involved in the secretion of mucus in the stomach. And the mucus of the stomach, that mucal layer protects the lining of the stomach, because remember, the stomach is very acidic. So if you have an acidic stomach and you have mucus there to protect it, you're fine. But if you take prostaglandins and you block the mucus, now all you're left with is acid in the stomach. And acid in the stomach will eat away the stomach and give the person an ulcer. So ibuprofen and other NSAIDs are typically, NSAID stands for non-steroidal anti-inflammatory drug to treat pain, fever, and inflammation. So when we look at inflammation, we'll see that within the cells, we have something called arachidonic acid. It's in the cell membranes. But when you get inflamed, the arachidonic acid can turn into prostaglandins, or the arachidonic acid can turn into leukotrienes. Arachidonic acid can be converted to prostaglandins through this COX enzyme. COX stands for cyclogenase enzyme. If you have the enzyme, you make prostaglandins. If you have prostaglandins, you can have a fever, you can have mucus in your stomach, platelets function, you can have uterine cramps. But if you block them, then you start to affect inflammation, pain, and swelling. So they take these aspirin, ibuprofen. These are COX-1 blockers so that you never get prostaglandins, so that you don't get pain, swelling, and inflammation. The other side, arachidonic acid with LOX enzyme, which is lipoxygenase, leukotrienes are involved with the airways. I think of bronchoconstriction and airway blockages. This is involved with asthma. So people who are taking asthmatic medications, these are leukotriene blockers so that the bronchioles don't get constricted, but they stay open and dilated. Okay, that's a little bit on inflammation. Foods that are pretty high in arachidonic acid, animal products, pretty high. When I say animal products, I mean animals that are traditionally raised animals, not grass-fed animals. When you have pasture-raised animals that are grazing on the grass and they're roaming freely on the farm, those are healthy animals to eat. You're not going to get as much inflammatory responses when you're eating the byproduct of an animal that's not very inflamed. But if you're eating the byproduct of an animal that's raised on grains, which are very inflammatory, then you increase the amount of inflammation in the body. Okay, shellfish, also very high in arachidonic acid. Peanuts, peanut butter, very, very high in arachidonic acid.